As we progress through rehabilitation with lower limb conditions, we'll want to begin increasing the speed of movement and challenge the lower limb's capacity to manage impact forces. And when we're managing impact forces, we have to respect that the distal tissues will take on much more of an important role because they directly interact with the external environment versus the segments of the more proximal tissues, the more segments more proximal to the foot and the ankle. But there may be times when we want to reduce contribution from certain proximal segments, certain proximal joints, especially if they're sensitive to load or if a lot of force production is being concentrated through one particular segment, and we want to work towards redistributing that contribution elsewhere. Submaximal hopping strategies that you'll see here in just a moment are great ways to shift that workload into the distal tissues at the foot and the ankle. So if you take a look at the hopping strategy here, you'll see much more of a vertically biased force output. And this will still keep that load at the foot and the ankle, but also challenge knee extension more. And if you look closely at the shin angle here, you'll see much more of a dynamic shin angle as it moves forward and back, which represents more contribution from the knee joint. Okay. Now, if we wanted to reduce that contribution from the knee, we can use a banded setup like this to create more of a horizontally biased force output. Okay. Now the direction of pull here doesn't necessarily challenge hip extension because it's a submaximal jumping strategy, hopping strategy, and the hip isn't really moving through a big movement excursion. But what it does do is it helps us redistribute that pressure into the forefoot and reduce that dynamic shin angle, which reduces the contribution from the knee joint, particularly that knee extension moment. Okay, so again, if you look closely at the shin angle here, it stays positive or forward throughout the hopping task, and this will really allow you to get a lot of load into the plantar flexors without that contribution from the knee. And in rehab, we use this resistance band setup to really maintain that load at the foot and the ankle while reducing the contribution from the knee before we progress into more hopping strategies where we're actually displacing the trunk horizontally. Okay, so give this a try and let us know how you get on.